Hi everyone. I wanted to talk to y'all today about EMDR. EMDR stands for Eye Movement Desensitization and Reprocessing. It's actually one of my very favorite types of therapy because it's so effective, and I've just seen so many clients have positive outcomes after doing it. So this eye movement desensitization and reprocessing, EMDR, it is an evidence-based therapy, which means that there is tons of research and other people who have studied this to make sure that the techniques and the way that we do the EMDR therapy, it's actually going to work. Okay, so this isn't just hocus pocus, I'm just doing some random stuff. That's not what EMDR is. This is an evidence-based therapy. What that means for you as a client is that you get the very best, highest quality care that we can provide, and which I think is really important, especially when you've gone through something really hard. EMDR, a lot of people do use it for PTSD and trauma, and it is, like I said, like the gold standard of treatment for PTSD and trauma. I love using it for lots of different things because I find that lots of different events could be very traumatic to a person. Things like maybe like infidelity, the loss of a pet, losing someone you love. These are very traumatic events that we can use EMDR to help with, in addition to the PTSD and other things that might come up for some people. One of the things that really got me started with EMDR was the very first training I had for it. I'm gonna be honest, I really wasn't 100% sold on EMDR before I went to that first training. And when I went that very first day, I remember that moment, and I was like, I can never go back to regular just talk therapy alone, because I have found EMDR to be so helpful and so effective so quickly for clients. In fact, a part of being trained in EMDR is actually being an EMDR client yourself. So me, myself, I have had a counselor do EMDR therapy on me. So I've seen firsthand how powerful this technique can be, which 100%, I want to do anything I can to help my clients. One of the things about EMDR, like I said, it is very powerful. I think that is a positive to EMDR and is also a negative, and I want to explain that. It is a positive because it helps memories process so quickly. It's a negative because it helps memories process so quickly. And if you're not ready for all those memories being processed so quickly, that can be really, 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 really hard, okay? So a huge part of EMDR is preparing you to process those memories, making sure that you have enough resources and coping skills, and make sure you have enough things to help you and support you before we really get to the root of the problem, okay? EMDR is using a lot of bilateral stimulation. Bilateral stimulation can be done in a number of ways. Eye movements, that's one of the best ways. Sound, tapping. I actually use a program called Remote EMDR, which I'm going to do a video about in next, so you can see it also on my YouTube channel. Remote EMDR is a platform that I use, and I find that very effective. So there's lots of different ways to do remote EMDR and EMDR, and just for our clients. This is something that I have a lot of experience doing online. I feel very comfortable with that. I really like that my clients can have therapy in the comfort of their own home, especially when we're working on some of those really traumatic and difficult memories and feelings. I find that it's very helpful for clients to be comfortable. I really want everybody to be comfortable. So I absolutely love doing EMDR online for my clients. If you have any questions about EMDR, how it works, you think that it might be helpful for you, please reach out. It is my pleasure to help however I can. And I love doing it. So thank y'all.